Hi, my name is Carrie. I'm a nurse practitioner student.
Hi, Carrie.
Hi. So today we're going to be doing a full head to toe exam. Okay. First thing I'm going to do is going to wash my hands, and then we're going to ask to check your mental status. So can you
Okay.
tell me your name?
Christine Leach,
Okay. Where are you right now?
South Hamilton,
Okay. And can you tell me today's date?
August 3rd,
Okay. Excellent.
2023.
You got it. Okay. Excellent. Okay. Next. So throughout this exam, I'm going to be taking a look at your skin, looking for any abnormalities, seeing if there's any signs of any infections, disease processes, lesions, anything like that. I'm just going to check your fingernails 1st. So we're going to check cap refill. Hard to do because she's got nail polish on, but we would do this. So normally it would be less than 3. Okay. And then we're going to get into the rest of the exam. We're going to start with the head, eyes, ears, nose, and throat. Okay. So first we're going to start with the head and the face. So first thing we do is inspect. So we're going to take a look. I see the eyes and the ears. They're symmetrical on both sides. I'm going to take a look at the skull and the scalp. I'm not seeing any obvious abnormalities on inspection. Next, I'm going to palpate. So I'm just going to feel your scalp and your skull, okay? All right. Not feeling any lumps or bumps. Hair distribution and texture is average. To be expected. We got no balding. Like a nice short haircut. Okay, so no trauma, no malformations or anything there. So that's good. And then next I'm gonna check for what's called TMJ. I don't know if you've heard that before.
Yep.
Okay, so I'm gonna check. I'm gonna palpate here. Have you open and close? Okay, any tenderness?
Nope.
No. Okay, good. And next, we're going to move on to a set of facial expressions. This one's fun. We're going to test some cranial nerves. So we're going to test facial nerve, which is cranial nerve 7, and then the cranial nerve number 12, which is the hypoglossal nerve. Okay, so here we go. So have you squeezed your eyes shut? Okay, wrinkle your forehead. You can open your eyes and wrinkle. Okay, very good. Smile, frown, stick your tongue out at me. Puff your cheeks out like a chipmunk. Okay, excellent. Okay, next I'm gonna feel up here while you're clenching, okay? So clench. Okay, let go. Clench again. Excellent. Okay, so this is testing the trigeminal nerve, which is cranial nerve number 5. We're gonna do one more thing. I'm gonna push up, you're gonna try to push down. Okay, she's got good strength there. And then to continue on with cranial nerve number 5, the trigeminal nerve, we're gonna do sharp and dull sensations on different parts of your body. So I'm gonna come over here and get my supplies. So this one is sharp. I won't push too hard. Tell me if it is too hard though.
Okay.
And then this is dull.
Okay.
So I'm gonna have you close your eyes so you can't see, okay? So we're gonna do different parts. You just tell me what you're feeling.
Sharp. Dull. Dull. Sharp.
Okay, go down here. Sorry.
Okay. Sharp. Sharp. Dull. Dull. Sharp.
Okay, and then down here. Sorry.
Dull. Sharp. Sharp. Dull.
Okay, perfect. So that was also trigeminal cranial nerve number 5, if I forgot to say that. Next, we're going to check your shoulder strength. We're going to check cranial nerve number 11, which is a spinal accessory nerve. Okay, I'm going to push down on your shoulders. You push up.
Okay.
Excellent. Okay, very good. So that finishes up the head and face part. So we go head, eyes. Next, we're going to look at your eyes. I'm going to get real close here. We're going to look at eyebrows, eyelids, eyelashes. Everything looks symmetric on both sides. Sclera are white. I'm just going to check your conjunctiva, okay? Nice and pink and moist. Beautiful blue eyes. Everything looks the same on both sides. So I'm not seeing any visual abnormalities. The palpebral folds, there's no slanting. Everything looks good. Now I'm going to palpate, which just means to touch.
Okay.
So you can close your eyes if it's more comfortable. All right, the lacrimal apparatus and sac. Okay, that's good. Nothing's coming out there. So after we palpate, we're going to do some vision exams. We're going to test your vision, okay? First, we're going to test the optic nerve, which is cranial nerve number 2. So we're going to test your vision. So this is called a Snellen chart. I'm going to hold it out here. I'm going to have you read this line right here.
Okay.
Can you read this?
Like the OXO.
Yes.
Yep.
Okay, and then this one down here.
XXO.
Good, and then down here.
XOO.
All right, and then down here, if you can.
OOX, maybe?
X, okay. Yep, she did. So she's got 20/20 vision. So again, that's testing the optic nerve, which is cranial nerve 2. And then we're going to go into testing your pupils. So I'm going to shine a light in your eyes. and just check to see what your pupils do. Okay, make sure they react appropriately. So you can just look straight ahead. All right, and we're checking both sides, so direct and consensual. Okay, I'm just gonna have you follow this. Oh. Okay, so pupils are equal, round, and reactive to light and accommodation, which is testing cranial nerves 2 and 3, which are the optic nerve and the ocular motor nerve. And then next, we're going to test extraocular movements. So you are going to look straight at me, but then you're just going to follow with your eyes. Okay, you've probably done this
Don't
before.
move my head, just my
Just your eyes, exactly. Okay. I'm going to check. Perfect. You got it. And then this is testing cranial nerves 3, 4, and 6, which are the ocular motor, the trochlear, and the abducens. It's a mouthful, but there we go. Okay, so that was a normal exam there. Last one we're going to do is called visual confrontation, visual fields by confrontation. Okay, so what we're going to do here is I'm going to have you cover this eye. I'm going to do the same thing. So look straight at me in like your peripheral vision. You're going to see a number.
Okay.
So don't look over, just look straight and tell me what number you see.
2, 1,
Okay, then cover the other eye.
1, 2.
Perfect. Okay, this is also testing the optic nerve, which is cranial nerve number 2. Okay, and then lastly for the eyes, I'm gonna come over here, get my ophthalmoscope. So normally in a clinical environment, we would turn the lights off so we could see better, but for the sake of the video, we're gonna keep it going.
Okay.
And for the sake of your height, normally we'd be at the same height. I'm just gonna have you help me out a little bit here. Okay. First thing we're gonna do is identify the red reflex. There it is. Bear with me as I get close. Look in the arterioles and veins, no nicking. Optic disc margin sharp. No signs of macular degeneration. No papilledema. Okay, sorry about that. We're gonna go into the next one. Again, looking for the red reflex. There it is. Again, arterioles and veins, there's no nicking. Optic disc margins are sharp. No macular degeneration, no papilledema. Everything looks normal there. So I'm gonna turn this off. And then at this point, I would turn the lights back on so I could see. All right, you can take a seat. So that's the eye portion. Head, eyes, ears come next. Do you mind just putting your hair behind your ears? Okay, perfect. So first we inspect. Not seeing any visual abnormalities. They're symmetric. Next I'm going to palpate. So I'm just going to touch the auricles. You tell me if there's any pain. No. When people get swimmer's ear and things like that, this can be painful. So no?
Nope.
Okay, good. Now we're going to test your hearing. So the first thing we're going to do is the whisper test, which is testing cranial nerve number 8, the vestibular cochlear nerve. So I'm going to have you cover this ear. You can either push down or stick your finger in, whatever you want to do. And I'm going to whisper some numbers in your ear, and you're just going to repeat them. Okay?
2, 7, 9.
Perfect. Now the other side.
5, 18, 12.
Perfect. Okay. So that's a normal whisper test. Normally we would stop there because you know your hearing is good, but there's some other tests we do if that is an abnormal result.
Okay.
So what we're going to do now is called the Weber test. I'm going to use this tuning fork. I'm going to put it on top of your head.
Okay.
You tell me if you hear it equally in both ears or if you hear it better in one ear. Okay?
Feels equal.
Equal.
Yeah.
Okay, excellent. So that's a normal Weber test. The next one is called the Rene test. And what I'm going to do, again, the tuning fork, I'm going to put it on the back of your head here. You tell me when you stop hearing it.
Okay.
And then I'm going to put it in front of your ear, and you tell me if you can hear it then.
Okay.
Does that make sense?
Yep.
Okay, so I'll explain as I go. So just tell me when it stops.
Yep.
Okay, can you hear it now?
Yes.
Okay, perfect. We're going to do the same thing on the other side.
Okay.
Again, same thing.
Yep.
Sorry.
Yes.
Perfect. Okay, so that's another normal test. That's the Rene test. Okay, excellent. So now the testing is good. We're going to take a look inside your ears. So I'm going to grab my equipment over here to look inside your ears. And again, we would want to be at the same height. So I'm just going to have you stand up for the sake of this exam here. Got my light on. I'm going to have you face the camera just so we can show. All right. All right. External canals look unobstructed. Not seeing any signs of wax, no signs of infection or scarring, anything like that. Tympanic membrane is intact. Conolite is at 5. No signs of infection or inflammation or fluid behind the ears. That's good. I'm just going to have you turn that way. Perfect. We'll do this side. All right. External canals look unobstructed. Tympanic membrane is intact. Conolites at 7. No signs of infection or fluid behind the ears or anything like that. So that's a normal exam for the ear. You can go ahead and take a seat. And then after the ears, we have the nose. So we're going to inspect. We're going to take a look. Everything looks aligned. Can you tip your head back a little bit? All right. Septum looks like it's midline. Not seeing any obvious enlargements in there. Okay, next you can look at me. I'm going to palpate your sinuses. You just tell me if there's any tenderness, okay? No?
Nope.
Okay, good. All right, next I'm going to take a look inside your nose.
Okay.
So I'm going to get a new speculum here. Turn my light on. Okay, have you tip back?
Mm-hmm.
Take a quick look. All right. Septum's midline, nasal mucosa is moist and pink. Not seeing any enlarged turbinates. All right, looks good in there. No discharge or anything. All right, we're good. Turn this off and put it back. All right, next we're going to do 2 tests for your nose. First, we're going to check patency. So I'm going to have you occlude one side. Breathe out of the one. And then switch. Perfect. Okay. One last thing, we're going to test cranial nerve number 1, which is the olfactory nerve. And then, so I'm just going to have you close your eyes.
Okay.
And I'm going to have you identify the scent.
Okay. Cinnamon.
Cinnamon. Okay. Cinnamon. Very good. All right. Next, we're going to look at the throat. All right. So again, we start with inspection. I'm going to look outside at her lips. They look moist and pink. Not seeing any dryness or cracking. And then I'm going to take a look inside. Can you open up? Thank you. Oral mucosa is moist and pink. Not seeing any dental issues. Can you stick your tongue out? Say ah. Uvulas midline, no tonsil or swelling. Lift your tongue up so I can lift the bottom. Excellent. Excuse me. No signs of B12 deficiency. We're good there. Okay. You can close. No signs of exudate or redness, so no signs of infection. Palates are good. Everything looks good inside. Okay. Put this back. Okay. So we looked inside, and next we're going to do 1 test for cranial nerve. We're testing cranial nerves 9, 10, and 12, which are the glossopharyngeal, the vagus, and the hypoglossal. Sorry, that was a mouthful. Okay, now I'm going to have you swallow. Easier said than done sometimes. Say your full name.
Christine Leach.
Okay, excellent. Okay, next, one last thing we're going to look at is we're going to inspect the trachea, which looks midline here. Looks good. And then I'm going to have you turn that way just so I can palpate your thyroid.
Okay.
And if you do you mind just moving your hair?
Oh, sure.
Thank you. All right, can you swallow for me? Okay, no thyromegaly, no enlargement of the thyroid there. Excellent. Okay, and then next we're going to move on to checking the lymph nodes in this upper part of your body.
Okay.
I'm going to name them as I touch them. You let me know if anything's tender.
Okay.
Okay. All right, got the preauricular, the postauricular, the occipital down here, the tonsillar, nothing?
Nope.
I'm not feeling anything in there. All right, submandibular, submental, nope, okay.
Nope.
And we're gonna go back here. Got the posterior cervical, the anterior cervical, and then these are a little deep. Apologize, the deep cervical. Just gotta get in between the muscle there. Okay, nothing there. And then we're gonna go up here. We have the suprascapular. I'm just gonna feel in here. And then the infrascapular is down below. Excellent. Okay, not feeling any nodes. You didn't have any tenderness or anything. Okay, next we're going to move on to the posterior chest, which means the back and also part of the respiratory assessment. So if possible, can I just have you scooch the face that way? Just so they can see my back. Yeah, if you don't mind. Just for the sake. Normally we'd be able to visualize better, see your skin and everything. But we're going to start here. So first thing we do is we always start with inspection. So we're checking her muscle bulk in her shoulders, looks appropriate. I'm seeing, a normal rate and rhythm, and I'm not seeing any signs of respiratory distress. Everything looks appropriate. Her effort looks normal. And then next we palpate. So I'm going to palpate for tactile fremitus. So I'm just going to touch basically and just compare anything. Okay, so that's equal bilaterally. And next we're going to check for chest expansion. So I'm going to put my hands down here at the 10th rib. Have you take a deep breath and then let it out. Okay, so we have symmetric expansion of my hands. So the chest expansion is symmetric. Okay, so that's palpation. And then next we're going to move on to percussion. So I'm going to be tapping on your back, okay?
Okay.
Okay, sound good on percussion. And then what we're going to do now, we're on the back here, we're going to palpate and percuss for CVA tenderness. So that's your kidneys. So check any tenderness in here. Okay, I'm just going to palpate. Any tenderness?
Nope.
Same thing over here, just let me know. Nope. Okay, and again, we're also inspecting and palpating the scapula and the spine. No tenderness?
Nope.
No, okay. And on visual inspection, I'm not seeing any abnormalities there. That's percussion. And then lastly, we're going to auscultate, which means we're going to take a listen, okay? I'm going to have you take some deep breaths, okay? Okay, whenever you're ready. And tell me if it gets to be too much, okay? All right, almost done. All right, 2 more. Perfect. Okay. So lung sounds are clear bilaterally. And then I just have to take this opportunity to explain a few things. So abnormal breath sounds you could hear would be crackles or rails, which are the same thing. It's like this popping, crackling noise that you hear when the small airways are popping open. And then the wheezes we hear often with asthma. It's from the airflow going through a narrowed airway. It's like that whistling quality. And then there are 3 other tests we can do. So if we had any abnormalities in the respiratory assessment, we could test for, first is agophony. So these are all when you're auscultating, so when you're listening. The patient says E, but it sounds more like an A. Bronchophony, the patient is saying 99. And under normal circumstances, it's kind of muffled and indistinct. But if you can hear it really clearly, that's an abnormal sign. We call that bronchophony. Then a whispered pectriloquy is when the patient is saying 1, 2, 3. And again, normally it's kind of muffled and distinct. If you can hear it really clearly, that's abnormal. And these are all signs of an underlying lung disease. Okay, for your information. Now I'm going to have you turn around so we can do the anterior or the front portion. Okay, so we're going to do a similar thing. We're going to inspect. Again, we can see good muscle in her shoulders here. Rate and rhythm look good. No signs of respiratory distress. Everything looks as it should. And then we're going to palpate. So again, we're going to do tactile fremitus. I'm just going to palpate here. Okay, this is all right. Symmetric bilaterally. Excellent. Next, I'm going to percuss. Same thing as I did on the back, just down for your lungs. Okay. All right. Sorry. Okay. So that's percussion on the front. And then we're also going to auscultate on the front, which just means listen. Just take a couple of deep breaths for me, okay?
Okay.
Have you do one more. Okay, again, no abnormal breath outs. Excellent. So that finishes up the respiratory portion. Now I'm going to have you lay down with your head on the pillows. We're going to move on to the heart portion.
Okay.
We call this the recumbent position. Okay, so first thing for the heart exam, you comfortable? Okay, so we're going to inspect. So first thing we're going to do is we're going to check the extremities, looking for any color changes, any edema. Not seeing anything, everything color looks good. And then any pulsations or heaves, so anything up here, not seeing anything there. And then we're going to check for what's called jugular venous distension. So I have a plain envelope and I'm going to use the ruler on the back of the Snellen chart here. I'm going to have you turn that way, your head just slightly
Just
that
my
way.
head.
Just your head, please, sorry. I'm going to palpate in here, okay. Get this to go straight. Okay, I'm coming at just about 2 centimeters. So that is a negative finding for jugular venous distension. We're not worried about any sort of heart failure with you, which is a good thing. Okay, and then next we're going to do palpation. Okay, we're going to palpate the P's for the heart system.
Okay.
Okay, we're going to palpate the heart right here.
Okay.
All right. I'm going to feel for any heaves or lifts. Cardium around the heart. Okay, not feeling anything. And then the PMI, it's called the point of maximal impulse, so where I can feel your heart beating the best.
Okay.
So I'm just going to be over on this side, okay? All right. Feel your ribs up here.
Mhm.
All right, so we are at the 5th intercostal space in the midclavicular line. Okay, so that's the PMI. Next, we're going to check your pulses.
Okay.
So we're going to start up here with your carotids. We're going to do one at a time, so you get blood flow to your head. Just going to feel them individually. Okay. Okay, and then we're going to move on to the brachials. These are the ones in your arms.
Okay.
All right. Okay, those are good. Next, we're going to move into the hands here. We've got the radial and the ulnar. Those are good. And I'm going to onto this hand. So this is the radial here. Good. Ulnar there is good. Okay, next moving down, we're going to check the femoral. So I just got to get up in here. All right. Good. Okay, those are good. And next, the popliteal. So these are going to be, thank you. So I'm going to have you bend your knees, actually.
Okay.
And then I'm actually just going to come behind here. That's good. All right, we're good there. Next, we're moving on down to the feet, the dorsalis pedis. I'm going to do them both. Okay, and then we've got the posterior tibial. All right, we're good there. Lastly, I'm going to check for down here is calf tenderness, which we can see with a DVT. So if you get clots in your leg, that can spread.
Okay.
So just tell me if there's any tenderness. Nothing in there. Okay. Excellent. Okay, so that's it for palpation. For the heart exam, there's no percussion. We're going to move on to auscultation, which means to listen. First thing I'm going to do is listen up here at your carotids for what we call bruits. So when I tell you, I'm just going to have you hold your breath, okay? It's the bell. All right, you can hold your breath, please. Okay, you can breathe. And then I'm going to try the other side. Okay, good. You can breathe normally. No bruits. Next, we're going to listen to your heart. So there's 4 areas of your heart. We're going to listen to them all. with both sides. One side is for regular heart sounds, the other side is for any murmurs. Okay? So you just need to hang tight. All right, the aortic, pulmonic, tricuspid, and the mitral. Okay, I'm gonna listen for any murmurs. Aortic, pulmonic, tricuspid, and the mitral down here. Okay, no murmurs. I'm gonna have you roll onto your left side and breathe out. Just while I'm listening. Okay, excellent. So that's checking for mitral valve stenosis. So that's negative, that's good. Last thing for the heart piece, I'm gonna have you sit up. I'm gonna have you lean forward and take a deep breath out. I'm just gonna get this on your heart first for aortic regurgitation. Okay, lean forward and breathe out. Okay, good. Negative for aortic regurgitation. Well done. Okay, so after the heart exam, we're gonna go into the axillae, which are your armpits.
Okay.
So I'm gonna have to palpate for some lymph nodes in there. So I apologize if it's a little tender. I'm gonna have you stand up just so I can reach better. Okay, so you tell me if anything's tender, okay?
Okay.
All right, these are the lateral. Okay, the central, sorry. All right, we've got the subscapular, and the pectoral. Okay, then the epitrochlear. I'm gonna put your arm there. None there. Okay, we're gonna do the same on the other side.
Okay.
Lateral, central, subscapular, pectoral. Nope, not feeling anything.
No.
All right, again, arm at a right angle. Trochlear. Excellent. Okay, that's it for lymph nodes up here. And then we're gonna go down to your belly. So I'm gonna have you lay flat so we can just stitch the pillows. You can put your head. Okay, so this is the abdominal assessment. First thing we do is gonna inspect. Do you mind just pulling your shirt up just so we can visualize your belly? Okay, thank you. We're gonna inspect the skin, look for any scars, hernias, pulsations, movements, anything of that nature. Doesn't look like you've had any surgeries down there or anything. No. Okay. So that's it for inspection. I'm not seeing any abnormalities there. And then in the abdominal assessment, we go right to auscultation next. So I'm going to listen in all 4 of your quadrants for your bowel sounds, okay?
Okay.
Start down here. Okay, we've got normal active bowel sounds there. And then next I'm going to listen over your liver and your spleen for what we call friction rubs, okay? Hearing any there, and then your spleen is over here. Okay. Excellent. Not hearing anything there. And then the last thing I'm going to listen to, can I pull your shorts down just a little bit? Okay. We're going to listen for any bruits down here. So with the bell. All right. You got aortic, renal, iliac, and then we're going to come down here for febrile. Okay. All right. Excellent. Okay, everything sounds good for that part. And then we're going to percuss. So I'm going to percuss in all of your quadrants, okay?
Okay.
Which just means me tapping my finger, okay? Listen. I'm not concerned about any masses or anything. Okay, that's percussion there. Then we're going to percuss up for your liver, and I'm actually going to get a measurement of your liver. Okay, so I'm going to get my tape measure. So I'm going to. Okay. Measure centimeters. All right. We got 7.5, so we have a good size. And that's at the liver span at the midclavicular line. Okay. And next we're going to percuss down to your spleen over here, okay? So splenic dullness. That's hard to get in. All right, there we go. Got it down there, okay? So that's percussion. Lastly, we're going to do palpation. Just making sure I got all my things. Okay, we're gonna start lightly, and then we're gonna do deep. So I'm just gonna do one hand down here. You tell me if there's any pain or tenderness or anything.
Nope.
And then we're gonna go clockwise. Okay, anything?
Nope.
Okay, next we're gonna go deeper. So I'm gonna take two hands, I'm gonna push a little bit deeper, okay? Again, just tell me if anything's coming up. All right. Did you feel anything there?
Nope.
Okay. And then we are going to, that's light palpation. And then we're going to move on to some special maneuvers to test for any abdominal symptoms. So certain disease processes. So what we're going to do, the first one is called rebound tenderness. It's a test for peritonitis. I'm going to push down. You tell me if it hurts more when I'm pushing down or when I'm letting go. Does that make sense?
Yeah.
Okay, so this is for peritonitis, rebound tenderness.
Pushing down.
Okay, excellent. Okay, and then the next three are for appendicitis. So the first one is the psoas sign. So I'm going to have you just try to push your leg up. This one, sorry. Okay, does that hurt down here? No. Okay, good. And then we've got the obturator. You can just bend your knee and then tell me if it's hurting at all down there. No? Okay. And then we've got one more. It's called the Rovsing sign. All right. And then I'm going to push down here. You tell me if it hurts over here.
Nope.
No? Okay. And then the last one, the last special maneuver is testing for cholecystitis, which is inflammation of the gallbladder.
Okay.
So I'm going to palpate deeply up here while you take a deep breath in. Tell me if there's any pain in there? No. Okay. And then the one thing I want to go back to do that I realized I didn't do was to palpate up here for the liver border. Okay. Take a deep breath in for me. All right, there it is. Okay. And then palpate for the spleen, which under normal circumstances, we should not be able to get to. Okay. And then, so no spleen. And then check for kidneys. No. Also good. Don't want any kidney inflammation. Okay. Palpation there is good. Okay, and then we did the special maneuvers. So that's going to bring us down, complete the abdominal part of the exam. Next, I'm going to have you stand up. We're going to do the musculoskeletal part. Okay. You can pull your shirt down. You can stand up. Okay, so we're going to assess your stance. You look balanced. You look coordinated. I'm just going to have you walk back and forth just to make sure. You can walk back that way. All right, everything looks smooth and coordinated. Excellent. I'm going to have you actually face that wall over there and have you bend forward. Okay, so we're going to inspect the spine. Again, normally we would visualize this here. I'm not seeing any scoliosis, any curvatures. And next I'm going to palpate. Tell me if there's any tenderness, okay? Okay, everything feels as it should here. Okay, I'm going to have you turn around and face me. We're going to do some range of motion exercises. So I'm going to have you bend forward for flexion. Okay, extension is back. Okay, and then lateral bending, so just to your size. One side and then the other. Excellent, and then you're going to rotate your back and your head to one side. Perfect, and then the other side. Excellent. Okay, so that's great for the spine. Next, we're going to move on. I'll have you sit down. We're going to look at the joints bilaterally. All right, first thing we're going to do is we're going to inspect the neck. Do you mind just pulling your? Okay, thank you. So we're going to inspect the neck. Not seeing any redness. Not seeing any visual abnormalities. Okay, I'm going to palpate it, which just means to touch. All right, no crepitus, no warmth, no just tell me if anything's tender at all, okay? All right, nothing there with the neck. We'd be looking for any sort of neck pain or cervical spine issue. Next, we've got shoulders. We're gonna look. I'm not seeing any redness. I'm gonna palpate. Any tenderness? No. Okay. No crepitus. Not feeling anything there. In the shoulders, we'd be worried about rotator cuff injuries, dislocations. We can get arthritis everywhere. Okay, we're gonna move on down to your elbows.
Okay.
So I'm gonna take a look. Sides, not seeing any redness. I'm gonna palpate. Tell me if anything's tender.
Nope.
No. Okay, I'm gonna check the other one too. All right. No crepitus, no tenderness. Things you'd be looking for like golfer's elbow, tennis elbow, fluid buildup, things like that in there.
Okay.
Arthritis. Not seeing anything there. Next, we're gonna move on to the wrists. Again, not seeing any redness. I'm gonna palpate here. Tell me if there's any tenderness at all. No. Okay, no crepitus, no fluid. Check the other one. Wrist injuries. You know, you can get breaks, you can get sprains, you can get carpal tunnel, all sorts of things. Not seeing any evidence here. Lastly, we're gonna take a look at your hands, including your fingers. There's no redness. Tell me if there's any tenderness. There's no nodules, which you would see in osteoarthritis and rheumatoid arthritis. So that's good. Again, no nodules over here. Excellent. No tenderness. Great. Okay, next we're going to move on to like the lower joints.
Okay.
So I'm just going to try to visualize your hips.
Sure.
All right. So we look for any redness. I'm not seeing any. Palpate. Any tenderness in here?
No.
No. Okay. No crepitus. There's no fluid buildup. No crepitation. Okay, I'm going to check the other one. All right. No redness. No tenderness.
Nope.
Okay. No crepitation. We're good there. Okay, next we're going to move down to the knees. I'm going to take a look. Neither of them look red, which is good. And then I'm going to palpate, okay? Oh, hips, we could get osteoarthritis or dislocations. All right. No redness at the knees and no tenderness?
Nope.
Okay. Excellent. Excuse me, not feeling any fluid. Not feeling anything. That could be suggestive like a meniscal tear, an ACL injury. You could get arthritis. Those are all things you can end up with in the knees. Next, we're going to take a look at your ankles.
Okay.
So we'll just, all right, I'm not seeing any redness. Just tell me if anything's tender. Okay, no crepitation, no tenderness. Ankles are good. Okay, things in the ankles, again, you get fractures, sprains. You can do all sorts of kind of injuries with your ankles. Okay, next we're gonna do the feet. They don't look red. They look good on inspection. Check the toes. We can get gout, we can get arthritis, get plantar fasciitis. Anything? No?
Nope.
Okay. Check the other one. Again, toes are good. Excellent. Okay, so that's it for the joints there. Get back up. Next, we're going to take a look at one upper extremity. We're going to do the shoulders. So I'll actually have you stand up.
Sure.
All right, so we're going to check muscle bulk. Looks good. I'm going to test your strength, so just push up. She's very strong there. We'll give her a 5. Next, we're going to do some range of motions. So you can just follow me. Abduction, adduction, flexion, extension, and then internal rotation and external. Excellent. Okay, so shoulders look good. Next, we're going to check a lower extremity. We're going to do the knees. I'll just have you sit down for this one. So again, we're going to check muscle bulk. She looks like she has great bulk here. I'm going to have you push up. Okay, good strength of 5. And next, there's really only 2 things your knees can do. You can extend and you can flex, which is to bend them. Okay, perfect. Knees look great. Next thing we're going to do is measure leg length. So I'll have you put your head there and your legs down, just as before. We'll measure in centimeters from the hip down to the ankle. All right, so centimeters here. All right, 4. Hip here. All right, 94 as well. Your legs are even, which is good because otherwise you could have some, you could be off balance and it could cause some muscle injuries and such. Okay, and then for the musculoskeletal system, we have some special maneuvers, which is what we're going to do next. These are fun.
Okay.
The first one is testing for a meniscal injury. It's called McMurray's. All right. Okay, that's good. Not moving any more than it should. So that's a negative McMurray's. Next, we're going to test the valgus stress test, which is testing for an MCL cruciate ligament injury. It's a mouthful. Okay. Okay, that one's a negative there. And then we have the Vera stress test, which is testing for the LCL, which is the lateral. Okay. Okay, that one's negative as well. Good. Not looking at any cruciate ligament injuries. I'm going to have you actually bend your knees, and I'm actually going to sit on your feet to do these next tests. See? All right, so the anterior, am I good on? Okay. Anterior drawer test, we're going to pull forward. There's no exaggerated movement, so that's negative for an ACL injury. And then pushing back, testing for the posterior cruciate ligament. Those are negative as well. Then the last sign we do is looking for the bulge sign, we call it. So for any fluid, we call that an effusion in your knee. So we would milk any potential fluid down. We would put our hand medially and tap. And there is no fluid in there. So that is a negative bulge sign. That wraps up the musculoskeletal portion. Okay. We're in the home stretch here. So next we're going to do the neuro exam. So I'll have you sit up. Yep. So first thing we do, as always, is inspect. Her appearance looks appropriate. She's got good hygiene. She's alert and oriented. Behavior is appropriate to the situation. Okay, next we're going to move into some specific testing. Okay. So we're going to do sharp and dull. Okay. And we're going to do it on your lower arms and hands, and then lower legs and feet. Okay. I'll walk you through it. So okay. I'm going to have you close your eyes again, just so you can't see. And again, sharp and dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp, I think. Dull. You go, okay. It's a brain exercise too. We'll do this arm, okay? Dull. Yeah, I'll push harder when I need to. Okay, my bad. Sure. Okay. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Okay, I'm gonna move on down this way. So grab your lower legs. Again, you can keep your eyes closed. You ready? Dull. Sharp. Sharp. Dull. Sharp. Sharp. Okay. Dull. Dull. Okay. All right, we'll do the other side. All right. All right, eyes closed. Yeah. Mm-hmm. Okay. Dull. Dull. Sorry. Sharp. Dull. Perfect. Okay. Great job. And then we're going to move on to the vibratory sense, or vibration sense, excuse me. So we're going to start in your wrists, and then we're going to do your ankles and your big toes. So basically, are you feeling anything? Just tell me and what it feels like. Vibrating. Okay, good. We'll check the other one. Okay. And then we're going to do your ankles. Okay. I'm going to do it again. Okay, and then we're going to do big toe. Okay, so we're checking any sort of peripheral neuropathy. Vibrating? Okay, good. So vibration sense is good. Next, we're going to do something called stereognosis. Have you close your eyes? I'm going to put a common object in your hand. You're going to manipulate it and identify it for me, okay? Key? Perfect. Okay, we've got a key. Next, we're going to do what's called graphesthesia. So I'm going to have you give me one of your hands. Close your eyes. I'm going to pretend to write a number on here, and you get to identify it, okay? 8. Very good. Excellent. Okay, you can open your eyes now. We're going to do some finger exercises. Okay. So alternate fingers. Yep, index fingers. Okay, now I'm going to have you touch your nose with one finger and then touch mine. With the same one. With the same one. It's okay. Keep going. Make sure you're coordinated. Okay. All right, you can stop there. So now we're going to alternate fingers touching our thumbs. Perfect. Okay. Excellent. Okay, and then we're going to do palms up, palms down. Excellent. Okay, and then take one of your heels and rub it down, or yeah, write it down. Okay, and then the other one. Sorry. Perfect. Okay, now I'm going to check the position sense of your great toe, which is your big toe.
Okay.
I'm going to have you close your eyes. You tell me, am I moving it up or am I moving it down? Okay, I'm going to do the other one. Go ahead.
Oh, down.
Yeah, sorry. Okay, next I'm going to have you tap your toes on my hands together, and then we're going to do separate. So tap them together. Okay, now separate one at a time. Excellent. Call that toe tapping. Okay, next we're going to move into the deep tendon reflexes. All right, I'm going to start with a brachial radialis. Okay, right there. All right, and then we're going to do the biceps. All right, we're getting 2 so far. All right. Okay, and then the triceps are behind. All right. All right, so we're getting 2s, and then we're going to move down to the knees. Go this way so we can see better. All right. Okay, and then we're going to go down to the ankles. I'm actually going to get this one behind. Okay. Okay, so we're getting 2 pluses, and then the last one we're going to do is what's called the Babinski reflex. So have you lift your foot up. This one, you don't want it to be positive unless you're a young child. So it might tickle, I apologize. Okay, that's a negative Babinski. And up here. Okay, also a negative Babinski. Excellent, that's what we want. Okay, last thing we're going to test today are some cerebellar functions.
Okay.
So balance and coordination and all that. So I'm going to have you stand up. We're going to do what's called the Romberg test.
Okay.
Oops, sorry, I pulled my microphone. I'm going to have you stand with your feet together. Okay, and you're going to close your eyes for 30 seconds, and I'm going to see how much you sway. Okay. Okay, that's 30. Okay, minimal to no swaying, which is a normal finding. Okay, this is called pronator drift. Keep your eyes open for this one. So palms up and arms out. It's gonna make sure you can keep them even. Excellent, and you can. So we're negative for pronator drift. Now we're gonna do some walking exercises. I'm gonna have you stand over here. I'm gonna have you walk on your heels. Excellent. And then you can turn around and walk on your toes. Very good. And then heel to toe. So heel, yes, so heel to toe, you know, like I said, if you hopefully don't get pulled over and they ask you to do this. It's a good test of balance. Okay, excellent. Okay, you can come back over here now. Thank you. Excellent. Now I'm going to have you close your eyes and balance on one foot. Okay, take your time. Okay, and then switch. Excellent. Okay, now you can open your eyes. You're going to hop on one foot. Okay, and switch. Excellent. And the very last thing we're going to do today is a deep knee bend.
Okay.
Do you want me to show you?
Like a squat.
A squat, exactly. We're in the CrossFit world. It's an air squat. You ready? Perfect. Okay, great. Everything looked good today. That's the end of our exam.
Okay.
Thanks so much for coming in.
Thank you.